Hello, welcome to this webinar, The RD's Role in Dental Health, How Traditional Diets Can Support Strong Teeth. For those of you who aren't familiar with Oldways, we are a nonprofit nutrition education organization whose mission is to inspire people to embrace the healthy and sustainable joys of the old ways of cooking and eating. Heritage-based diets high in taste, nourishment, sustainability, and joy. Since 1990, we've helped people live healthier, happier lives by offering educational programs, resources, and recipes based on shared cultural food traditions from around the world. It's a mission we take great joy in, one with proven nutritional and emotional benefits. Just a few housekeeping notes. This session is being recorded and our attendees will get an email with the CPEU certificates as well as the slides and recording. Please visit our website, oldwayspt.org/CPEU. There you can find recordings of all of our previous webinars and the slides to them. And that's also where you can go to sign up for new webinars that we have coming up. We will have a brief question and answer session at the end of the presentation. So stay tuned and submit your questions using the chat feature as you think of them. We have two really fantastic speakers today. Ellen Karlin is a registered dietitian and nutrition consultant with vast professional knowledge in nutrition and dental health. She has been a nutrition consultant to dental healthcare professionals in Maryland for 30 years. She has also been a nutrition consultant at the Comprehensive Asthma and Allergy Center for the past 30 years. Ellen holds a Master of Medical Science degree in nutrition education from Emory. She is a fellow of the Academy of Nutrition and Dietetics, a member of Food Allergy Awareness and Education, and serves as a volunteer for these organizations. A nationally recognized speaker, she has delivered numerous nutrition lectures at healthcare conferences throughout the United States. She was the co-author of Dental and Oral Considerations in Pediatric Celiac Disease, published in 2016. Ellen has contributed to a variety of other resources, including Trendy Diets and Oral Health, published in Access Journal, December of 2019. We also have with us today Dr. Sara Karlin. Sara is a board-certified pediatric dentist working as a clinical adjunct assistant professor at Arizona State at Arizona School of Dentistry and Oral Health and Children's Rehabilitative Services in Phoenix. She received her Bachelor of Science degree from the University of Maryland, College Park, and completed her DDS at the University of Maryland School of Dentistry. Dr. Karlin pursued her specialty training at NYU and Bellevue Hospital, earning a certificate in pediatric dentistry. Dr. Karlin is a member of the American Academy of Pediatric Dentistry, the American Dental Association, and the Arizona Dental Association. Dr. Karlin is a nationally invited speaker on the subject of nutrition and pediatric oral health. She is the primary author of Dental and Oral Considerations in Pediatric Celiac Disease, published in May 2016, and has contributed to other resources. So these are our learning objectives for today. We're going to take a look at the bi-directional interrelationship between nutrition and oral health. We're going to look at the association of traditional food patterns and food synergy to prevent oral infectious diseases. And we're going to talk about the role of the RD in dental care. So with that, I'll hand it over to our speakers. Thank you.
Poor oral health leads to compromised food choices. In this instance, we think about the patients who are not only edentulous, but the patients who have caries, and Sarah's going to talk to you in detail about that moving forward in the presentation, and poor nutrition increases the risk of oral disease. There are key messages from our evidence-based research guidance from the government and from health organizations. So just to quickly point this out to you, the Oral Health in America report from the Surgeon General mentions that diet affects oral and craniofacial health. Our Academy of Nutrition and Dietetics has a position paper out that states nutrition is an integral component of oral health. These position papers are available to you, so I won't read the entire quote, but the key take home is that as registered dietitians, we should be incorporating oral health in our nutrition assessments, in our treatment plans to promote oral health and prevent oral health diseases. And Sarah's organization, the American Academy of Pediatric Dentistry, I was able to find this as their most recent handout online, where not only are they telling children that they need to brush their teeth, they're telling children they need to eat healthy, they need to snack healthy. And it is their position, which I loved seeing, that they state to eat a healthy diet, stay away from those sugary, gummy, chewable vitamins. So now Sarah's going to start off the presentation by reviewing with you the hard tissue of the oral cavity.
According to the American Academy of Pediatric Dentistry, tooth decay is the #1 chronic infectious disease affecting children in the United States. Children have a total of 20 primary teeth, and they begin to erupt around ages 4 to 6 months of age. These teeth are especially susceptible to decay because they're smaller in shape and they have a thinner enamel outer layer, so the caries can progress faster to the inside of the tooth, which is the dentin, and once the decay is into the dentin, then it must be treated. According to the reports from the National Center for Health Statistics in 2019 data, 18% of children have caries between ages 2 to 5 years old, 45% of children 6 to 11 years old, and 54% of adolescents 12 to 19 years old. These numbers are alarmingly high considering that caries is a preventable disease. The cariogenic process is very influenced by the patient's diet. It's important to note that caries is a process of demineralization and remineralization. So if a tooth is in a demineralized state for too long, that's how decay can begin. And for the tooth to be in this demineralized state, the patient must eat something that causes an acidic environment. Once the tooth is in an acidic environment, it becomes weaker and demineralized, which leads to decay. And if the decay is not treated in a timely manner, it can lead to a chronic infection in the mouth. Patients with severe early childhood caries have negative effects on all aspects of their life, not just decay in the mouth. It can cause chronic dental pain, and if a patient is in pain, then they're not eating. I have patients who come in and say they're in pain. They're either not eating on one side of their mouth or they just cannot eat at all. And that is definitely a concern. It can lead to malnutrition. If a patient has a tooth that has a large cavity in it, sometimes that tooth cannot be saved and it must be extracted, which leads to premature tooth loss. If a patient loses a primary tooth too early, if the space is not maintained, then sometimes it can block out the primary teeth from erupting. So it's very important. The best space maintainer is your natural tooth. So we definitely want to keep these teeth to prevent issues down the road. It can also be a huge economic burden for the parents because if a child needs full dental rehab, they have caries on several teeth, they need extractions, dental work can become very expensive. And so it can definitely be a burden on the parents. And a study recently looked at the quality of life for children and parents with early childhood caries. And they found that there's a significantly lower quality of life for both the child and the parent. And I know that for my patients, if the child is uncomfortable and not sleeping, waking up in pain, waking up with pain in the middle of the night, then the parent is also uncomfortable, not sleeping, and waking up in the middle of the night. These children also can have several absences from school, whether it be because they are in dental pain or because of so many visits to the dentist. Both the American Academy of Pediatrics and the American Academy of Pediatric Dentistry recommend early dental visits. This is the most important take-home message, in my view, for this presentation regarding oral health, is that the child's first dental visit should be within 6 months of eruption of the first tooth or by age 12 months. And the reason why this is so important is because that first visit, we review prevention, and prevention is key. We review brushing and flossing, we review diet. And so this is a big emphasis on nutrition. And this is a great time for the registered dietitian to become involved in the education process, because as we just discussed, diet is key to prevention as well. If a child comes in and they establish a dental home by age 12 months and they return every 6 months, the goal is that the patient will not have decay. And if they do, we catch it when it's small and it can be treated with a small filling or just prevented. And then we also place topical fluoride every 6 months, and regular checkups are very important. Caries is multifactorial, and it can be affected by genetics, hormones, medications, and overall health. So there are several dietary patterns that can affect caries. First is the form of the food. So I always review diet with parents and patients. And if a child is drinking juice, for example, orange juice, I usually recommend that the child eats the orange instead, because as we all know, it's more filling, it has fiber, and it's less likely to cause decay because the patient is chewing, the saliva is flowing, and it's not like the juice is just sitting on their teeth. Another important thing to note is the duration of the exposure. So if a patient is drinking juice, I usually recommend a maximum of 4 to 6 ounces. I always show the parents that's about this much because that's a small amount. And with a meal at one point during the day. Some patients, the parent will give them juice in a sippy cup and they'll sip on it all throughout the day. Let's say when they're in school or daycare and they're just constantly sipping on the juice. That means that the teeth are constantly being demineralized and they never have the chance to be in a neutral state of remineralization. So if they do have juice 1 time a day and with a meal, that's always important to note. Retention time is another factor. If a child eats crackers or chips, they don't necessarily have sugar in them, but they get stuck in their back teeth, in the molars, in the grooves, and they get broken down. I always explain to parents, they get broken down the same way as if they ate a cookie, because it's the fermentable carbohydrates, they get broken down and cause cavities. And we all know when we eat crackers or chips, they get stuck in our back teeth, but we'll usually drink water or brush our teeth afterwards because it's uncomfortable. But kids sometimes will just let those crackers just sit there. I had patients about a year ago, they were 2 new patients, and I was going to take a look at their mouth, and the parent says, "Oh, I'm so sorry, we just ate a snack in the car." And I say, "No problem, that keeps us busy. We have something to do to clean their teeth. It's not a problem." But I had the kids open and they had just had crackers. Both children, I believe they were 6 and 4 years old, they both had crackers sitting in their back molars on the top and bottom, just sitting there. And so I showed it to the mom and explained why it's so important to brush or drink water with the crackers or have something healthy such as cheese, which leads me into nutrient composition and buffers. So I always recommend that patients have a healthier snack such as yogurt or cheese. Dairy is great because they contain nutrients that help remineralize the teeth. I like to tell my patients that dairy is almost like an Uber ride for the teeth because it transports calcium, phosphorus, magnesium, and casein to help remineralize the teeth, and it prevents an acidic pH in the mouth. So dairy is great. I always recommend that for patients. And fluoridated water is very important. Fluoride has several important properties. It prevents demineralization and it allows for remineralization. So it allows for the teeth to be healthy and in a great remineralized state. So I always recommend my patients drink fluoridated water.
Sarah, that was wonderful. Thank you. And that leads me into the fluoridated water recommendations. Both the American Dental Association and the new dietary guidelines, which I'm going to talk about in the next slide. But just to summarize, the guidelines have just come out, the 2020 to 2025. We're so excited because now they, for the first time ever, include birth through 2 years old. And they do state establishing a healthy beverage pattern is equally as important, or is an important part of an overall healthy dietary pattern, and specifically state that we need to be recommending fluoridated drinking water. So let's talk about the dietary guidelines. Those of us who are registered dietitians know this, but there may be some people tuning in that are not familiar with the guidelines. So I want to tell you that these are government regulations based on evidence-based science with guidance that tells us how we should be eating as a population in order to have health promotion and disease prevention. So it's guidance that we should be following throughout our entire lifespan. And the guidelines even include pregnancy, which is so important, because when we think about those first 1,000 days of a child's life, that includes the mom when she's pregnant as well. So we want to make every bite count with the dietary guidelines. That's the theme that we should be teaching our patients for the next 5 years. And there are 4 bullets that come with this theme. One is to follow a healthy dietary pattern. One is to customize and enjoy nutrient-dense foods, but we want to take into account foods and beverages that reflect patient preference, patient culture, and patient budget. And we want our patients to meet nutrient-dense needs with nutrient-dense foods that are also varied. We want to make sure that patients get a lot of variety in their diet, so they're getting all of the nutrients and the phytochemicals that they need. And of course, limiting foods and beverages high in added saturated fat, salt, alcohol, and the focus of this presentation, high in added sugars. When we look at how are we doing as a population, are we following the dietary guidelines for Americans? We have what's called the Total Healthy Eating Index scores. And unfortunately, let's face it, when you look at these scores, let me explain first that a score of 0 means that we are not following the guidelines at all. A score of 100 means that we are following those guidelines exactly. So as registered dietitians in a perfect world, of course, we want to see 100s across the board. But unfortunately, we are literally failing. Okay, look at our teenagers. A 51 out of 100 would be their score. And when you think about it, they have more autonomy in terms of their food selection. And, they think they know it all. The frontal lobe of the brain doesn't even develop until like age 25 or 26. So they know better than we do, of course, as RDs. So they are going to eat what they want to eat. And unfortunately, this poor nutritional intake is going to affect their oral health as well as their systemic health, which we know. But what's also so disappointing is look at ages 2 to 4. I mean, these kids are so young, they're eating what their caretakers are feeding them. So we really have to do some education. And then with our elderly population, we had talked about when you're missing natural teeth, it's very difficult to eat those nutrient-dense foods. So I know that we know this, but I feel like it bears repeating. We are eating too many processed foods and too many foods high in sugar, and we really should be focusing and teaching our patients to be eating nutrient-dense diet. That leads me to this article. And actually, when I was putting this presentation together, I said to Sarah, this was published in the Journal of the American Dental Association. You talk about this. She said, Mom, you love that study. You talk about it. And I do, because this was in a dental journal, and this was a cross-sectional study of over 7,000 adults. They used data from N. Haynes. And we know that sugar has a direct relationship to caries. That we've known for years and years. But these researchers actually looked at healthy eating index scores, because we know that some foods that we eat are cariogenic, right? They cause caries. But some foods that we eat, like dairy and fruits and vegetables and whole grains, which we're going to talk about, are cariostatic. They increase that salivary flow. They actually prevent caries. So these researchers actually looked at healthy eating index scores, and what they found does not surprise us at all as RDs, was that the better the patients ate, the higher the HEI score, the less untreated caries they had. And they specifically stated less sugar and more nutrient-dense foods, whole fruits, total fruits, greens, legumes. I wanted to mention this study because it's so unfortunate that we know that traditional dietary patterns that contain healthy whole grains, such as the way people in Nepal eat, their traditional diet includes a food called dal bhat, and this is rice, lentils, and vegetables. And it's very healthy. It's a nationally recognized dish. Some individuals eat it twice a day. And their traditional snacks are healthy. It's corn, popcorn, roasted soybeans, food made from locally grown whole grains, wheat and millet, right? But what's happening, according to this cross-sectional study, which looked at diet, nutritional status, and oral health of 273 Nepali children ages 6 to 12 years, is that these kids are eating sweets, ultra-processed snacks, sweetened beverages. So what are we seeing? These researchers looked at malnutrition as defined by World Health Organization criteria and found that these kids are having stunted growth, underweight, they're wasted, and severe caries was associated with acute malnutrition, as Sarah was telling us earlier, and with chronic malnutrition in older children. Again, this association or this bi-directional, inextricable link between caries, malnutrition, we see this over and over again in the literature.
For the next minute or so, let's talk about sugar. Some of the sugars in our diet are intrinsic natural sugars, which are found naturally in the food, such as whole grains, fruits and vegetables, and of course, we all know that milk and dairy has lactose. But what's very important to point out to your patients is that intrinsic natural sugars do not contribute to caries. They may actually be protective against caries. As I mentioned earlier, they have fiber, they have fluid, polyphenols, and it increases the mechanical stimulation of salivary flow. A study published a few years ago showed that chewing an apple may even reduce bacterial viability in saliva, similar to toothbrushing. So that's great. An apple is a great snack. And also, dairy provides the calcium and phosphorus, which is important for dental health and systemic health. As opposed to intrinsic sugars, which are found naturally in foods, there are greater than 50 terms for added extrinsic sugars, and some of these synonyms are listed on this slide. There is no nutritional benefit from refined sugars, even though some of them are healthy sounding, such as beet sugar, date sugar. It gets very confusing for our parents and patients. The Dietary Guidelines show us the top sources of sugar in our diets is sugar-sweetened beverages, followed by desserts and sweet snacks. Within the sugar-sweetened beverages category, the highest source of added sugar is soft drinks.
Speaking of sugar-sweetened beverages, there is a plethora of research in the literature about the relationship of sugar-sweetened beverages, poor nutrition, and sugar-sweetened beverages and caries. I just wanted to mention two of them to you or point them out to you. And by the way, all of our references, and there are a lot, are included at the end of our presentation, and you will be able to access them online. So just briefly, a cross-sectional study that was published in the Journal of the American Dietetic Association many years ago found that increased sugar-sweetened beverage intake is associated with decreased calcium in young children. And we know how important it is that our young children get their calcium, number one, to prevent osteoporosis later in life, and number two, for their proper teeth development. And then a very recent study was just published in the Journal of the American Dental Association. And this study looked at over 14,000 people, very young, 2 years old, all the way up to age 74, and found an independent association between drinking sugar-sweetened beverages and caries association or caries risk. So we know that we should not be having sugar in our diet. Sara and I have made that perfectly clear, and you knew that before you tuned into the webinar for sure. But this study, I don't even know if it's published yet. I found it online. It's unbelievable. This was published in Pediatric Obesity, right? They looked at parents of children age 1 through 5. Do parents even know how to identify sugar in beverages? And the answer is no. They were allowed to look at the front of the package and the back of the package. They were not able to identify sugars. They thought, they had misconceptions. They thought that unsweetened juice contained added sugar. They thought sweetened flavored water did not contain sugar. They thought that 100% fruit juice had less than 100% fruit juice. So we have to teach this to our patients. We have to teach them how to read labels. I think that the new labels that have the percent daily value of added sugar and that have the amount of added sugar now is going to make it easier, but we have to educate them. And before you switch to the next slide, Sara, I do want to point out that these parents were not able to identify non-nutritive sweeteners. And I have to admit that even as an RD, it's difficult to identify non-nutritive sweeteners, right? There are 8 non-nutritive sweeteners approved by the FDA. They include aspartame, azosulfame potassium, monk fruit extract, neotame, saccharin, sucralose, stevia, advantame, right? You almost have to be a scientist to recognize a non-nutritive sweetener. And the guidance says that children should not be drinking beverages with non-nutritive sweeteners because we don't have enough research to say that they are safe for young children, especially in this age range from 1 to 5. We do have beverage guidance, which Sara and I are so excited about because it's the first time we've ever had this guidance. This is so exciting also because this is healthy eating research, healthy beverage consumption in early childhood recommendations from key national and nutrition organizations. And 2 of them are Sara's organization and our organization, the American Academy of Pediatric Dentistry and the American Academy of Nutrition and Dietetics. The other 2 is the American Heart Association and the American Academy of Pediatrics. And what they say is we now have research to tell us that what children are drinking from birth through 5 years old matters. And they give you guidance, which I'll just briefly go through. All children age 5 and under should not be drinking. Look at the plethora. First, let me stop and tell you, there's a plethora of beverage choices, right? Our parents are so confused. There's fluoridated water, there's bottled water, there's sparkling water, there's flavored water, all kinds of dairy milk, there's organic, there's conventional, all different fat levels, flavored, chocolate, strawberry, there's toddler milks, and we know all about the plant milks, the oat and the hemp and the chia and the almond and the rice and the pea protein based and caffeinated drinks and sugar sweetened, and you get the point. There's also culturally specific drinks like Brazilian tea and bubble tea, which we're now drinking, which are loaded with simple carbohydrates and sugar. And the guidance is saying that babies need breast milk or formula, 6 to 12 months, breast milk formula with a little bit of fluoridated water, 12 to 24 months, milk and water. And as Sara was saying, maybe a 4 to 6 ounce juice glass if needed, even though of course they tell us milk and water are the go-to beverages. And again, we give you the reference and you can read more about this, but we are absolutely ecstatic that this guidance is available to us.
We tend to take for granted that our patients understand the caries process, but it's my experience, and as shown in this article, which was recently published in the Pediatric Dentistry Journal, that our caregivers do not know that much about the caries process. So in this article, they looked at 55 caregivers of pediatric dental patients, and it showed that they have a poor understanding of caries etiology, the role of fermentable carbohydrates in pit and fissure caries development, which is what we discussed earlier with the crackers and cookies and chips getting stuck in the back molars, and caries prevention in general. They do have a good understanding that sugar is cariogenic and that the children should avoid sugar-sweetened beverages, candy, and sweets. So a lot of my patients and their parents, when I start to review nutrition, the parents say, oh, don't worry, my child doesn't eat candy or drink soda. So we know that they understand that, but it's important that they understand the rest of the nutritional guidance that we provide. And even though these parents are confused, we know that they want to do what's best for their children, to take care of their children and provide good nutrition and oral health care. So the take-home message is that education is key, and the registered dietitian can be so helpful and play a huge role in the process of caries prevention.
In terms of maternal obesity and child's caries, we see a plethora of research on this topic as well, but I wanted to point this one out because it really brings home the point that we really have to prevent obesity throughout the life cycle. And what this research showed was it was based on data from the Norwegian Mother and Child Cohort Study. Children who had a mother who was obese, or if mom's diet was rich in sugar and fat early in pregnancy, were at a higher risk of developing caries at age 5. If the child had a mom who was obese, they had a 2.3 times higher risk of caries development. When mom consumed more sugar than we would recommend, these children had a 1.5 times higher risk of developing caries at age 5. And if mom consumed more fat than recommended during pregnancy, these children had a higher risk of developing caries at age 5. And as we know as RDs, it's so important that we teach our pregnant women, our lactating women, our patients who are of childbearing age. We really need to eat those nutrient-dense foods, stay away from all that added sugar, stay away from all that saturated fat in order for them to be healthy, but also to prevent this intergenerational obesity epidemic that we currently have in our nation. So of course, just to summarize what we've talked about so far, we want to promote a healthy dentition. We want to promote healthy eating patterns, behaviors, and habits. As Sara said, we want the frequency of food and beverages to be at least 2 hours apart, discourage frequent snacking, discourage cariogenic foods and sugar-sweetened beverages. But parents don't always want to hear what shouldn't I do, they want to hear what should I do. So as RDs, we want to teach them to select those nutrient-dense cariostatic foods. And whenever I work with dentists or I speak to them, or I just gave a presentation to dental hygienists, when you think about it, all foods that are nutrient-dense that we want our patients to eat for systemic health, these foods are beneficial for oral health as well. They're cariostatic. They do not cause caries, like your healthy fats, your lean proteins, your fruits, your vegetables, and your whole grains. So talking about whole grains, we know that they're nutrient dense. The Oldways website has this awesome handout. Patients just don't know how important it is to have whole grains in the diet. They contain fiber, vitamins, polyphenols, minerals, antioxidants. They're good for our gut microbiome because we need that fiber to produce those short chain fatty acids, which are so beneficial for our health. Studies are starting to show us they're also good for the oral microbiome as well. And our patients don't know that they can have amaranth, barley, buckwheat. I actually just tried fonio for the first time about a month ago, and it kind of reminds me of cream of rice, but there's just so many different options. There's triticale, there's teff, there's sorghum, there's rye, there's freekeh, there's millet. And this handout is great because it tells us try a new one every day. And I think that our patients need to be focusing more on whole grains. The dietary guidelines tell us that we should make half of our plate whole grains. And the dietary guidelines tell us that 98% of Americans are not eating enough whole grains. So we really want to promote this for our systemic and our oral health as well. And now Sara's going to review with us the soft tissue of the oral cavity.
So first we'll look at gingivitis, which is the inflammation of the soft tissues. And it's the initial condition that can predispose the patient to periodontal disease. We want to reduce the severity of gingivitis, and you can do that by having good oral hygiene, coming to the dentist every 6 months, and a diverse, nutrient-dense diet, which includes, we want to make sure our patients have an adequate calcium, vitamin D and K, magnesium, and phosphorus intake, because we want to support the alveolar bone density. The alveolar bone supports the teeth, so it's very important. And then for healthy oral soft tissue, we need adequate calories, protein, vitamin C, A, and E, omega-3 fatty acids, iron, zinc, and antioxidants. So a very nutrient-dense diet is needed. Moving on to periodontal disease, it affects 50% of adults in the United States, and it's a chronic inflammatory disease that leads to systemic inflammation and tooth loss if it's untreated. It's caused by the bacteria P. gingivalis and lipopolysaccharides, and the result is bone loss, which is definitely indicative of periodontal disease and definitely needs to be treated. When we have inflammation in the mouth, we have inflammation in the body. So therefore, periodontal disease is linked to a variety of systemic diseases, such as high blood pressure, cardiovascular disease, diabetes, adverse pregnancy outcomes, and even COVID-19. A recent study showed that patients with periodontitis associated with COVID-19 complications and even death.
So when we talk about periodontal disease, we can think about omega-3 fatty acids as maybe even preventing some of that inflammation. We know that we have 3 well-studied omega-3 fatty acids, the alpha-linolenic acid, which we can find in our plant-based sources. We have the EPA and the DHA, which we can find mostly in our low methylmercury fatty fish, such as salmon and mackerel and sardines, for example. And the research shows us that when we do have enough omega-3 fatty acids in our body, this lowers the risk of chronic disease, and most of the research is surrounding cardiovascular disease. But in addition, the anti-inflammatory effects of the omega-3s might even be protective against the periodontitis. And a study that was published many years ago in the American Dietetic Association looked at over 9,000 adults from NHANES, and they were able to find an inverse relationship between a high dietary intake, particularly of the DHA omega-3, and periodontitis. So again, this recommendation from the guidelines that tell us that we should be eating approximately 2 4-ounce servings of fatty fish, low in methylmercury every week may help to prevent many diseases systemically and periodontitis as well. And I believe Sarah had mentioned when she was talking about we don't want to lose the teeth in the young child, we don't want to lose those primary teeth. We also, of course, don't want our patients to lose our permanent teeth, because we know those of us who work in nursing homes or have elderly parents or have worked with patients age 65 and older, about 30% of people are edentulous or in America right now. So it's a big problem. We want our patients to keep their natural teeth, because when they have dentures, think about it, they're just plastic, right? Their bite force is reduced. They can only chew about 20 to 25% as well with dentures as they could if they had natural teeth. So again, those consultations that I get all the time, nutrition intervention, cut foods into small pieces, offer mechanical soft diet, moisten foods that are hard to chew. And we know that this results in malnutrition because it's hard for these individuals to eat many times where they're on a full liquid diet, and it's unfortunate. But there is now a dental intervention. Dental implants could help to restore mastication and then lead to the intake of more nutrient-dense foods in patients who are candidates for dental implants. And then the end of our presentation, Sarah and I are going to be talking about how what we eat impacts our oral health. There are many nutrient deficiencies that affect oral developmental disease, but I just wanted to highlight a few with you. If children are not having enough protein, then we will see delayed tooth eruption and delayed enamel solubility. If they're not getting enough vitamin A in their diet, we'll see impaired epithelial tissue development, tooth formation, and we'll see enamel hypoplasia. For our individuals who are milk allergic, for example, or many times we'll see it in our vegan population. If kids are not getting enough calcium and vitamin D in their diet, we will see, again, that delayed tooth eruption, hypomineralization of the tooth structure, and the abnormal alveolar bone formation as well. And we know how important vitamin C is for wound healing in the body. We'll see delayed wound healing in the mouth as well with vitamin C deficiency. I love to talk about food synergy because our patients want to take a vitamin supplement, right? We just talked about nutrient and complications. With the advent of the pandemic, there's been more and more, I can't even tell you how many questions I get from healthcare professionals when I give webinars. I just spoke to dental hygienists a few nights ago, and I gave them this similar presentation. As a matter of fact, I said, okay, great, this will be my practice for my Oldways presentation, right? And the first question I got was, I don't want to eat healthy. What vitamin supplement should I take? But I literally think I convinced her to eat healthy. It's not just the vitamin, of course, as dietitians, we know this. It's the food synergy. As the dietary guidelines tell us, we've realized that we're not eating a vitamin. We are eating foods. We're consuming them as a combination, a dietary pattern. We're talking about the totality of the diet. And when you look at this plate, I can't help but smile because I remember Sara said to me, I always have an avocado or olive oil with my salad because I know that you taught me this helps to absorb the lycopene in the tomato, the lutein in the leafy greens. So we really want to get this message across to our patients for our systemic health and for our oral health. Quickly, we know that plant-based diets are associated with lowering the risk of cardiovascular disease. I'll let you read this study on your own, but I want to point out that Oldways does have a handout, plant-forward plates. Those of you working in food service can get some great recipe ideas for that you can use, and this is free on the Oldways website. This particular study, to summarize, is saying that when we have a healthy plant-based diet, we are lowering our risk by about 19% of cardiovascular disease. And a plant-based diet might also help prevent gingivitis. Now, I know we're all at ease, we're very critical of research. I get that. This is a very small study, but it was the only one I could find, and I thought it was interesting. They looked at 32 adults, 16 people ate a plant-based whole foods diet for 4 weeks, 16 people ate their regular diet. And just after 4 weeks, the 16 people who ate a plant-based whole food diet, a healthy plant-based whole food diet, did have reduced gingivitis. When we talk about traditional dietary patterns or plant-based patterns, the Mediterranean diet pattern comes to mind. We know that it's more of a lifestyle. We know that it's a combination, as you can see from the base of the pyramid, of individuals being active, enjoying meals with others. You can see it's a healthy plant-based eating style, and these individuals are drinking a lot of water. And I put this in because Sara actually did research on the Mediterranean diet and oral health, and I wanted her to share that with you.
Yes, during my pediatric dental residency at NYU, our patient population had a very high caries risk. And as Ellen just mentioned, the Mediterranean diet has been proven to have many health benefits. So I was wondering if it had oral health benefits as well. So I worked with one dietetic intern and one dietetic student, and we assessed the diet in children in my patient population ages 6 to 12 years old. And we looked at how closely they were following the Mediterranean diet serving score. And I also compared that with their caries experience through their dental charts. Our results showed not only poor diet quality and high caries rate, but it was also very disheartening to learn that 100% of children in the study failed to meet the vegetable recommendations, and 90% of children exceeded the recommendations for sweets, fruit juices, and sugar-sweetened beverages. So my research just confirms what we've been talking about all afternoon, the inextricable link between diet and oral health, and how important it is to educate dental patients and parents about nutrition.
Couldn't agree more, Sarah. Let's move on. If you like spicy foods, then this is your slide. I thought that this was so interesting. This particular research was an in vitro study. It was done at Maternal University in Thailand. What these researchers did was they extracted essential oils from delicious culinary herbs and spices that are used in Thai cuisine, such as sweet basil, cinnamon bark, sweet fennel, kaffir lime, black pepper, peppermint, spearmint. And what they found was anti-plaque and anti-cariogenic properties. And the guidelines tell us that introducing herbs and spices into the diet is a healthy way, as we know, to cut back on sodium and flavor dishes that are unique to specific cultures. So it's important that we also encourage our patients to use those healthy herbs and spices for our systemic health and for our oral health. In terms of the Asian heritage diet, another handout available on the Oldways website, I thought that this was, again, very interesting. I was able to find that there are 4 sialagogues with evidence-based research in the literature. And again, I listed all of the references for you. But what's interesting, a sialagogue actually stimulates salivary flow. And when our patients get older, they have xerostomia. They have decreased salivary flow. And Sarah reviewed with you the importance of a good salivary flow. We need to have saliva to help cleanse our teeth, to promote remineralization. It actually brings that calcium and that phosphorus and that fluoride to our teeth. It also has antibacterial properties. So our patients with dry mouth tend to have poor oral health. Now, there are products on the market for oral health, which dentists can recommend, and many of which you can buy over the counter. But as RDs, we can tell our patients, use these delicious, nutrient-dense, full of antioxidant properties, herbs and spices, so that you can have the lower sodium diet, a delicious meal, and promote salivary flow as well. Who doesn't like chocolate, right? We all love chocolate. So I wanted to point this out. We all know that the polyphenols in cacao may be helpful in terms of our health, in terms of antioxidant properties, but the cacao polyphenols also might result in that bacteriostatic inhibition of S mutans, preventing that biofilm from being cariogenic and inhibit that acid production, which Sarah had talked about is so important to prevent caries. Our American Academy of Nutrition and Dietetics, on their website, so you can refer your patients, to eathealthy.org, has information, and I was able to find the most recent information that they have is called Healthy Nutrition for Healthy Teeth, and this was put up on their website in February of this year, and they state what Sarah and I have been talking about: eat a variety of nutrient-dense foods. They call out specifically the importance of calcium, phosphorus, and vitamin C, which we discussed. They give ideas of healthy snacks, raw fruits, vegetables, plain yogurt, and popcorn. Do not put the baby to bed with the bottle. And as Sarah and I talked about, limiting juice, flavored milks, and sugar-sweetened beverages. So you can also refer your patients to this website for this information as well. So in summary, the American Academy of Nutrition and Dietetics do tell us that the RDs have a role in the clinical setting, in the community, and through research. And Sarah and I are hoping that since there are so many opportunities to incorporate oral health into the clinical setting, that we want to facilitate an inclusive approach We want you to be creative. We want you to be innovative. We want you to explore this further. Sara and I hope that this knowledge is going to help you to be able to put these ideas into practice. For example, you can include, for moving forward in your everyday practice, include oral health screening in your nutritional assessment. Look for potential oral manifestations of systemic disease. Work with dental teams. Try to assess oral nutrition issues and help come up with treatment plans. Evaluate that potential impaired nutrient intake, especially when you're working with the young children, when you're working with pregnant moms, when you're working with the elderly. Collaborate with dental teams, work together in the community, work together for employee wellness programs. And if you're involved in nutrition research, please remember to incorporate oral health in this research. And we thank you so much. And it is our hope that you were able to learn something today that you can take to your own practice and use on a routine basis. And we have included our references for you. And we'd like to open it up to questions.
Thank you both so much. This was really amazing, and I think we all learned a lot from your presentations. We have a lot of really good questions here. So I'll just dive right in. Someone has a question. It came up pretty early in the presentation about dairy and reducing acidity in the mouth. And this person is wondering if there's any research on dairy alternatives for this purpose.
Sara, should I take it away or do you want to take it away?
You can take it away.
Okay, well, help me out if you have something to add though. Okay, so first of all, that is a great question. We are not sure exactly why dairy is so beneficial, but we think there is a lot of research. And again, the person who asked the question, please feel free to look through our references. We think that it's not just the calcium, the phosphorus, the casein, but we know that there's a dairy matrix. And there is a lot of research. Remember, we talked about the food synergy. There's a lot of research behind the dairy matrix and how that helps our bone health. And that might also play a role in oral health as well. So in terms of specific plant-based milk alternatives, certainly, and I'm sure Sara would agree, they will not be cariogenic unless they contain sugar. But in terms of being cariostatic and actually preventing caries, I don't know that that's been studied yet.
Thank you. We have a few questions here about breastfeeding. So people are curious, one, if there's any research about dental caries risk in breastfeeding at bedtime and throughout the night. And then another person is asking about breastfeeding a toddler aged child and if that has any relationship with dental caries.
Yes, so research shows that breastfeeding itself does not cause the decay, but once the child is consuming other foods, such as the fermentable carbohydrates, the combination of the two can lead to decay. So for breastfeeding, the most important thing is that the child goes to sleep with their teeth brushed at night. So if the child is falling asleep while being breastfed, you want to wipe the teeth off or brush them afterwards. So that is a great way to prevent decay. And yes, so that's breastfeeding at bedtime. Afterwards, brush their teeth, and then they should be okay. Oh, I see. It also says throughout the night. So we do have that as well. If they do wake up in the middle of the night and they're breastfed, same thing, wipe their teeth off and then they can go back to sleep.
Great, thank you. Someone is asking about like seltzer drinks, like bubbly waters, and if that has any relationship, because a lot of these beverages don't have added sugars most of the time.
Yes, excellent question. We both love seltzer water. I could live on seltzer water if that was an option. There are mixed studies out there because I've looked into it for myself because I drink so much of it. And there is a study, I believe it's on the ADA or AAPD website, that says that it hasn't been proven to have any negative effects. Is that correct? I'm going with that study because I drink milk. Do you agree? I believe.
Right, I can just add to that that the ADA on their website, they do state that sparkling water is fine. It's similar to drinking plain water.
Plain water is best, but I love seltzer
Fluoridated water.
Yes, plain fluoridated water is best.
Thank you. Are you aware of any interventional studies showing diet change later in life with improvement in dental health? Or like, is there a point where it's too late or?
It's never too late. I don't know of any studies, but it's never too late. I always tell my patients after we do the cleaning and fix their decay, it's like they're starting fresh. It's like they're starting anew. And it's always, there's no time that's too late to have a healthy diet and improve your oral health.
And along those same lines, it's never too late to have a healthy diet and improve your systemic health. So again, we both agree.
Yeah, thank you so much. We have another question about plant-based milks. We noticed on the handout about the recommended beverages for children 5 and under that plant-based milks were recommended not to have. And we're wondering if this resource had any recommendations for children with like milk protein allergies, or, you know, what the guidance was.
That's a great question. So again, I would like to refer you to the guidance itself, but the Dietary Guidelines for Americans along those lines do state that soy milk would be an appropriate substitute for dairy milk in the case of a food allergy to milk.
Thank you so much. All right, and then I guess I'll just give you one more question. Someone had a question and they said they thought it looked like tea and coffee were acceptable beverages for dental health, or did they misunderstand?
Oh, well, that's another great question. Okay, so dentists may not like this very much because, of course, the tea and the coffee stain the teeth. Mm-hmm. However, they do have those polyphenols, which have been so beneficial to dental health. So I guess, Sarah, as long as you brush your teeth regularly, would you say? And also, I tell my patients to drink white tea or drink green tea because that wouldn't stain the teeth. Sarah, would you agree?
Yes, I just want to add, you just have to be careful that the patients aren't adding in sugar or honey or any added sugars, that it's plain or just with milk or something like that. That's a big thing to point out with that.
Thank you. Well, thank you all for being so generous with your time. And again, for those of you who tuned in a few minutes late, we'll definitely email you the recording, the video recording, as well as links to the slides so that you can review these references and resources on your own time. And we'll also be following up with the CPEU certificate. So that will be coming within 1 week. And thank you all. So with that, I will say goodbye. Thank you.